What I want to do is maintain this virtual community that we've built. And I want people to keep challenging me and pressing me. And I want to create a White House that is more transparent and accountable than any government we've seen before.
So that was then candidate Obama on the trail, talking about making health care reform transparent. As the crucial vote gets closer, all the talks seem to be behind closed doors, don't they? Top Democratic senators and aides and Rahm Emanuel from the White House. How about that transparency pledge after all, huh? Anthony Weiner, Democratic congressman out of New York. How you doing, sir? Good morning to you.
I'm doing well, Bill. Thank you.
We're dying to find out what's happening behind these doors. I mean,
well, I'm your man. Any question you want answered, I'm here to do it for you.
What are they doing? Well, I mean, they're making deals. What's happening?
Well, after 80 hours of open hearings in the House and about 45 hours of open hearings in the Senate and thousands and hundreds of town hall meetings, now they're trying to figure out how to put these pieces of these different bills together. Believe me, there's going to be more information than anyone could want, but frankly, there's nothing really to talk about yet because there's a lot of disagreement about how we're going to merge these bills.
What happened to C-SPAN?
We've got Fox News. Who needs C-SPAN?
Well, I mean, we want C-SPAN inside the meeting to figure out what they're talking about.
Well,
hang on. You know this is a decision that if health care reform goes through, it impacts 1/6 of our nation's economy. It impacts 300 million Americans.
Is there a shortage of information here, Bill? Look, there are meetings that go on all the time. You don't open your news planning meetings every morning. The whole point of this is that there's tons of information out there.
I did not make a pledge to open up our
I don't think anyone ever made a pledge. I don't think anyone ever made a pledge that every government meeting held for the rest of time will be open to the cameras of Fox.
Didn't we just hear that, though?
No, you certainly didn't hear that.
Really?
This process hasn't been open enough for you.
Well, here's what you told the Washington Post.
You just had a ton of.
Here's what I'm told. I'm told a bill was 259 pages long. That was the markup bill from the Senate Finance Committee, and now I'm reading today that's 1,500 pages long.
I'm with you. I'm with you. It was never 259 pages. Look, our bill in the Senate was over in the House rather was over 1,000 pages.
And apparently the Senate's kind of 500 on that. This is what you said. We have meetings and more meetings and gripe sessions. This process has been almost open to death.
Yeah.
Open to death? What do you mean by that?
Well, there's just been, think about how much, if you wanted to sit from hour to hour and watch the hearings, you could have seen literally hundreds of hours of hearings and markup. I think that there's a lot of things that this process hasn't had right, but one of the things it absolutely has had is a sense of openness. My goodness, you have more tape than you can imagine of the deliberations in the House and Senate.
Look, I don't envy those who sat through the committee meetings, but I want to know what's going on behind closed doors. I mean, did those August town hall meetings mean anything when they were saying, read the bill?
Well, hold on. I'm not sure I understand the criticism. Is your criticism that this process hasn't been open enough, or that there's any meetings at all that are behind closed doors?
Of
course there are going to be. Here, Bill, let me finish my thought. Of course there are going to be some elements of this discussion between members of the House and Senate, the people in the administration that are going to be closed. Of course there's going to be some meetings that aren't going to be open to cameras. Is that a new step for you?
Here is what some are saying. Some are saying that you need to hammer out this bill, because if you did it in public, lawmakers would go at it like a piñata, and you would not be able to make your time limit and get it done in time before, let's say, Christmas or Thanksgiving. What about that?
No, I think that you're going to have plenty of opportunities for whatever the final bill is, and I think we should have a conversation about what should be in it rather than the process of getting there. But look, I think there's going to be plenty of opportunity. This process has been exceedingly open. It's been shouting and yelling and hearings and markups. I don't think there's been any shortage of transparency. What there has been is really only one party doing any of the work, because the Republican Party is absent themselves from this entire process. They've said no to just about everything. So now we're at the process of trying to hammer out 5 different bills that went through 5 different committees with 5 different open hearings and processes, 5 different bills people can read. I'm not sure I understand the criticism, except that maybe Fox News isn't allowed in the room where one of the meetings is being held.
It's not just Fox News, it's everybody. We just want to know. We want to know what they're hammering out. We were told everybody would have a seat at the table. What do you mean everyone is going to have a seat at the table? All 300 million Americans are going to have a seat at the table? You know, then Senator Obama said that would be the case. Who said it? Senator Obama during the campaign trail said everybody would be at the table. Look,
no one said everyone's going to be at the table. Bill, I got a news flash for you. You're not going to be at the table. Sorry, buddy.
I would take my rain check, okay, on that. But I'm still waiting for a camera to go inside. I think the bigger issue is this, honestly. On the screen, a poll that came out yesterday. 42% approve of the health care proposal. 54% oppose it. You see a warning sign in that poll?
Well, I saw a Washington Post poll this morning that says that over 60% of people support a public option. Listen, I'll give you a question you can ask anyone. If your health care expenditures in this country went from 17% to, say, 10%, is that good or bad? And everyone would say that's a good thing. Well, that's what we're trying to achieve. That's what the objective is. It's kind of like Buddhism. It's not like whether we're going to have change. It's whether we're going to have change on our own terms. Are we going to wait till it's 30% of our GNP? Is it going to wait for our 60%? We've got to get this cost under control. Every year, people's insurance rates go up $1,000. It's unsustainable.
10 minutes ago, we did the story from the Wall Street Journal that said every time the government predicts a program will save us money, it does not.
Well, listen, there's
not
no doubt.
One time.
Well, that's, first of all, that's not, I guess in that case, we should get rid of Medicare.
Well, I mean, you can take that up with your lawmakers.
No.
I'm saying this, in 1965, the estimate went out for Medicare. It said it cost us $12 billion.
Yeah, Bill, you know why that is?
It cost us $110 billion.
Bill, you know why that is? We are living longer, 10 years longer than when that bill was created. Isn't that what we wanted? Isn't quality health care what we wanted? Now, look, the problem is that people are schizophrenic about this. There's no doubt about it. You need to control the cost of health care. Therefore, what? Don't do anything?
Well,
I saw your last segment. It seems like the argument is don't do anything. Well, then it's going to go up even more. There's no doubt about it.
The one area where they found where actually the price went down had to do with competition when it came to Medicare prescription drugs. They found out when the companies were forced to compete against each other, the price went down.
Oh, no, but the only problem is
even more.
Yeah, that's exactly right. More competition, so we should make sure that we make them guarantee the lowest prices by having the government do that. Do we do that presently? Nope. We're going to do it in this bill, though. Look, the bottom line is this. Medicare, 3.5% overhead. Private insurance, 30%. Which would you prefer?
Anthony Weiner, you come on back, okay? We'll continue this debate, all right?
You're the man. Anytime you want to negotiate health care, you and me.
You got it. Thank you, sir.
Thank you, sir.
All right, Shannon.